Hi. Hello.
Hi.
Hi, Phil.
Hi.
Hello, Phil. How are you?
Hi.
Hello, Nicole. How are you feeling?
Good, thanks.
That's good. I brought Lauren here with me to review Phil. You know how you were talking about earlier. He's not settled and
That's
you know
right.
being very upset. So Lauren's here to review Phil.
So you've come into hospital this time, Phil, after having a fall at home, and everything's been x-rayed and there's no breaks, which is really good. But since you've come in, the staff have suggested that you're not really happy about, I guess, about being here.
That's right. He's been trying to climb out of bed, which is really out of character for him.
Okay, all right. And the staff have been experiencing problems in the afternoon and overnight as well.
The staff have tried sitting with him, offered him a cup of tea and gone through the album with him. So he's usually settled with a cup of tea and going through, he likes going through his album. Mm-hmm. But the staff told me that they still had difficulty in settling him last night. He was quite upset.
Okay, all right. So when I read the notes, the staff actually have felt that the sleeping tablet that we stopped a couple of weeks ago, they actually were requesting that be restarted. But what I was actually thinking, I wonder if pain has been assessed since he's been here.
I did ask him whether he has pain.
Yep.
He said no.
Yep.
And he's on paracetamol already.
Right. I know in the past we've worked with Phil and Nicole with pain at home. So we actually have a tool that we use called the Abbey pain scale, and that actually gives us an idea if somebody has got pain or not. So we might, if that's all right, just go through that and I'll just show you how we do it. And I guess the other thing to think about is even though somebody might be on paracetamol, their actual pain relief might not be enough for them at that time. So it's quite a simple tool, but it does need to be done whilst Phil is actually being moved or moving. So either think about before we came in when the staff were moving him in the bed, think about how he was presenting at that time, or even, you know, if he was up moving around. We start off by looking at vocalization. So if he is whimpering, groaning or crying, was he making any noises when they were moving him?
He's groaning a lot.
Groaning, okay. So, and that's most of the time?
Most of the time.
Most of the time.
Tried to move him.
So that would probably be a 2. The second area is looking at facial expressions. So if he's tense or frowning or grimacing, just really a change in what his normal would be, even looking frightened. So what did you think about that?
He always looks tense.
Yes, okay.
And yeah, he does get frightened at times when we try to move him.
Yep,
as well.
okay. So we'll give you a 2 for that one because that's most of the time. Now the third question is thinking about body language. So if there's been a change in body language, so if he's more fidgety, rocking, or even sometimes quite withdrawn, or even when you're moving, was he guarding any part of his body?
He's been fidgeting when we move him, sometimes withdrawn as well.
Okay, all right. So we'll give you a 1 for that. Now the fourth question is a change in behaviour, so either an increase in confusion or not eating, or just a change in the usual patterns or usual activities. So I guess what have you noticed?
He's not eating much.
He's not eating?
No,
okay.
And it's very hard to say because he does get confused in the evenings and night time.
Okay.
So yeah,
all
but
right.
he's not eating much.
Okay. And Nicole, even when you bring food in for him, is he interested in that at all?
No, not even his favourite foods. He hasn't really been eating them.
Okay. All right. Well, we'll give you a 1 for that. Now, a physiological change, often if somebody is in pain, you'll see a change in their temperature, pulse or blood pressure, or even perspiring, or a change in skin colour. So that's important to have a look at. I know we've had a look at some of his observations. What have you sort of noticed in terms of that?
His observation's been quite normal.
Okay.
But he does perspire a lot.
Okay.
Yeah.
All right. All right. So we'll give Phil a 1 for that area. And the 6th area is any physical changes, so any skin tears, pressure areas, history of arthritis or any injuries. And I know that, Phil, you've been diagnosed with arthritis in the past, which is why you're on the paracetamol. So that's one area. But because of your fall, you've actually got quite a lot of bruising, so you've got some injury to that hip area. So that would be a reason, a score of 2 for that area. So if we add those up, that actually comes to a score of 9. And that's actually telling me that that's quite moderate pain. So even though he's on the paracetamol, we've got a score of quite moderate pain. So probably the most important thing is what we do with that score, and we need to think about maybe increasing the pain medication and maybe starting something just a little bit stronger, Phil, just to try and make you feel a little bit more comfortable and a bit more settled. And then what we would do is we would redo the Abbey pain scale after we've given the increased analgesia, and even about an hour after we've given that, and that would just see if there's a decrease in the score and see if the analgesia is effective.
Okay.
Does that sound like a good plan?
I think it's a very good tool to use.
All right.
Yeah, thank you so much.
That's all right. So we'll leave some copies for the staff, and we'll work with Phil to try and get you a bit more settled.